Yeah, I will have to check again because do you see? Okay.
Yeah, recording has started.
All right. Great. So welcome to this panel debate from the Water webinar series organized by the University of Ghent, University of Queensland, and Berkeley University. This is a session on water power, and I have the pleasure to introduce to you our panel members. So this is Dr. Dirk Hallet from Flanders Knowledge Center, Water in Belgium, and Professor Helen Ross from the University of Queensland, who gave the lecture Social Implication of Water. So Dirk and I will first introduce ourselves and then ask some questions to start the debate. So I myself am Tina Huysse. I'm a biologist working at the Royal Museum for Central Africa in Belgium. And I focus on tropical diseases like bilharzia, which is also known as schistosomiasis. And this neglected disease affects more than 200 million people worldwide, especially young children in Africa. And it's caused by parasites that are spread by freshwater snails. The disease is usually not fatal, but it can lead to serious pathology, growth retardation, school dropout, and girls can become infertile. Now, treatment is available, but there is no vaccine. So this means every time that children will enter the water again, they become reinfected. And that's why it's also called disease of the poor, because it mainly affects people that have no access to safe water and sanitation. So they're forced to these natural water bodies for washing, cooking, their sanitary needs, but also for their animals to drink. So that creates conditions for zoonotic disease transmission. And the focus has been the last decades on mass drug treatment. So distributing drugs to school children on an annual basis, even whether they're not infected. And this had good outcome on morbidity, which dropped. The prevalence didn't. So the disease continues to re-emerge or emerge in new places. I will leave it here for now, and I leave it now for Dirk to introduce himself.
Yes, hello. My name is Dirk Hallet. I'm the coordinator of the Flanders Knowledge Center Water in Belgium, where we help and work together with governments, research institutes, and companies to innovate and implement water solutions. And one of the basic approaches in defining these innovative approaches is a systemic approach, where we first want to really understand the root causes of the problems, which also means that we have to descend to the level of the mental models, as you also presented, Helen, in your presentation, is to really understand the opinions, the beliefs, even the dogmas that steer the water system and make that things don't change actually. And for example, in the Western world, we have a mental model that supply meets demand. If the demand increases, we will put all efforts to assure that 24/7 we can meet this demand. Or we see that things that are not visible are insignificant. So if it's invisible, it's not taken into account in cost-benefit analysis, and that's we see as a huge problem in scaling up innovation. And that was also something that triggered me in your presentation, Helen, was the aspect of identifying these values as important things to also to consider, but where it's still difficult how we can integrate these values in the decision making. And also in the field of mental models, there's also the problem that sometimes we know what the mental models are, but and we know that actually they are limiting the rollout, the scale up of very valuable initiatives. And for example, we come later to that. If you have a mental model that you have a caste system that's actually the basis for social inequality, that's hampering certain developments. If treated wastewater is considered as impure in certain beliefs, this has a huge impact on the amount of water that can be reused. So this is also one of my questions, but we can discuss this later on, is how can we, first of all, have more insight in the values that are important to consider when implementing new water solutions, and how do we handle, how do we cope with mental models that are probably hampering this shift towards more sustainable water practices. And as I will end with that, as because I found it very inspiring. It was something I read from Donella Meadows, who says that paradigms of mental models, there's nothing costly or slow about changing a mental model, because it can happen for a millisecond in the person, but there's a huge difficulty in changing the paradigm or the mental model within a whole society. And this is actually the difficulty that we face, is how we're going to change some invaluable or some mental models towards another leading idea, which would really help the scaling up of water solutions.
Wow, that's an interesting point you make there about mental models being changeable, because we need to do a lot more research on them. It's still a relatively new field, especially when applied to complex problems. But I would not agree that they change readily. I think it depends on the part. So if something is very dear to people, close to their values, it's what they've always been brought up understanding, if it's central to their culture, that will not be easy to change. If it's something much more peripheral, it's no threat to the person's understandings, then they might change their mental model. But more likely, if, say, new information is consistent with the basic mental model they already held. So, you know, we all teach other university students, and you see them getting that aha moment when something new is introduced to them, and they'll take that on board, and they'll change parts of their mental model. But I assume it's not the one that totally forces them to reframe things that are really central to the way they live their lives. For instance, you know, expecting a major contradiction to their religion. So that's an observation, but right there, I would not assume that mental models change as easily as opinions do, for instance. I think a lot of them are down with the beliefs and values in terms of being strong. Now, you asked quite a complex question, but I think a very important point for everybody, whoever you are, and you know, whatever your occupation and role in a water situation, is not to assume that we're right and others are wrong. Now, in social science, constructivist research, it's called the Constructivist Paradigm. It's very much about appreciating and understanding different people's perspectives. We may reframe as much as anybody else can, and often, if one's goal, which is worth clarifying in itself, is to save death, save illness, look after children, get people into healthier circumstances, then I think it's pretty unwise to assume that we know best. And of course, we is a pretty broad category as well. We all come from different training and occupations in the West, and we've got our counterparts in many, many other countries. So where I think the mental models and the values, because I think they can be very complementary, are extremely important, is to understand, if you're trying to introduce a technology among a new society that hasn't had that technology before, you've got to understand how it's going to fit in their system. I love the way you mentioned systems and systems thinking. Part of that system is how they think the system works, which is the mental model. And then the values that as well. Yep.
Well, I would like to begin in what you said here now, because I was very interested by your talk, and then the talk by Prof. Kara Nelson from Berkeley University, because I think what she introduced at the end, she was talking about the Synergy toilet and the sanivation. And from my background of neglected tropical diseases, this would allow a major advancement in breaking this transmission cycle of bilharzia, because it would separate the feces from the water sources, and then it would break the cycle. But what I wonder, linked with these mental models, is whether you, from your background, Helen, whether you can provide some advice to ensure that indeed this synergy toilet will be accepted by the community, that it will be effectively used. And I ask this because when I would like to refer to India, where Prime Minister Modi built 100 million toilets to address the issue of open defecation in India, which is a huge issue. And according to Christian Silos, this is an example of failed innovation, because it indeed increased the access to toilets, but it did not change the behavior. And I also witnessed this in Africa, where brand new toilets are built, there is a whole ceremony, but then after that, nobody uses them. So I think it's maybe an example of coming up with a solution before understanding the problem. And I think this is where social sciences come in. So I would like to hear your opinion on this.
Gosh, you can go a little way back in the supply chain on an issue like that, because obviously one approach is doing a proper technology assessment. Don't assume, hey, we've got the great design, this is going to solve the problem. Just accept it, everybody. Here you go. Here it is. Because when you put that technology into a different society, and they will all have different behavior patterns, gender relations, other things might come into it, it'll be perceived and used differently. So technology assessment, which actually preceded environmental and social impact assessment, was about assessing how technology will fit in a situation. Don't assume it's going to work, especially based on, say, Western mental models of how diseases spread. You've got to engage with the people's context in every respect, and that includes their mental models and values. So now we look very much to co-innovation and co-design type approaches where you work with the people. Even if obviously you're not always going to say, well, you know, let's design a new toilet. First of all, do you need a toilet? Or why would you need a toilet? What do you think happens when there is open defecation in your vicinity? Because people might think, well, nothing, or it fertilizes the crops, it's good. So there's many levels to that. So I think co-innovation, co-design can be used very much in technology adaptation. Technology has to fit to context. So that's one way of working. And I would advocate using mental models and also values approaches to see how do people see the problem? Do they see there is a problem? Do they see a different problem? What do they think is the appropriate solution? And that you do need to treat people with respect as having valid understandings and quite often knowing more about a situation than you do. I work mainly in an agricultural and environmental field now, and lovely work done by a Kenyan master's student and friend a few years ago among his own people. And it was on acceptance of climate change technologies. So all these wonderful technologies designed for climate adaptation, and the people were rejecting them. And it turned out when he went in to discuss and ask about it, one of the water-saving technologies, which involved digging little pits and, you know, planting your crop down in the pits so that it was sheltered from wind and rain and the water sort of stayed there and didn't evaporate so fast, unfortunately looked like graves. So the people drew the association, these is graves, you know, this is inviting deaths, you know, we won't do that. The simple solution, of course, after much discussion with people, would have been dig them a different shape. There's plenty of other shapes you can dig a water retention pit. So I might be getting a little bit off track there, but certainly co-design, technology assessment, co-innovation, even if it's adapting a technology for a new context, is highly important. And I would say understanding people's mental models and their values is really important as part of that transfer of technology.
And in the case that that there's no problem for them, or it's really in contradiction to their beliefs, how do you handle then? I think the co-design process stops, or do you see there other approaches? Coming back to the case of India, where you have this belief, where you have a strong caste system, where they don't see the problem of defecating in the Ganges, or also maybe of the mental model that the Ganges has self-purifying capacities.
Yes, if things are totally contradictory, then you're starting from a difficult point, which does need some careful exploration in all directions, including, that the Western introducers are necessarily should be so sure of themselves on it. One thing we found in mental models research, and this was with my former colleague Nick Abel when we first worked on it in an agricultural field, is if you've got different stakeholders, as we were in that study, it's worth eliciting their mental models and comparing them. Where are the common roots? What have they got in common? So rather than talking at cross purposes about systems that don't match, look for the common elements. And I would now say, look for the common values as well. Nobody wants to get sick. Good, we're agreed on that. Now let's explore how can we prevent people getting sick. Yeah. Look, in agricultural extension, behaviour change, or all sorts of things, we've known for decades that just throwing information at people is not particularly helpful, not particularly convincing. You do need to go to these deeper ways of building from their current understandings. But I can see, this is really problematic. It's one thing to do with a small set of people in one community, and this is something you raised with me in correspondence. How do you scale up and out from small local interventions? Doing it on a mass scale is problematic, so it probably requires detail. I could imagine NGOs doing this sort of detailed assessment with typical type users, working out new ways, but never assuming one size fits all. When I was reading up on the Sanergy toilet, I said, might have worked wonderfully in some countries, but you cannot necessarily assume that it'll transfer comfortably to a different culture and country where all sorts of assumptions and behaviours and beliefs are very likely to be different.
Yeah.
Yeah, because I have a big project in Uganda and Congo on this transmission of the disease, and we would also like to, look for a solution. And so this Sanergy toilet, I would be really interested in that. But when we do these interviews now, because I mean, as I said, the prevalence is not decreasing at all in Africa, despite all this mass drug treatment. So that's why we started 2 years ago by inviting social scientists in our team to help us to find out what's going on. And apparently, for example, there in Uganda, they think that the fishes, when they enter the water, they will serve for the fish to grow bigger, and so it's good for fisheries. So they have these beliefs, or they think it's also part of a ritual. I mean, one of the symptoms is that you're peeing blood. Because of this infection, the eggs in the body will create lesions, and so they think it's a sign that they're growing up. So
right.
So it means that there's a lot of myths or misbeliefs maybe, and so trying to find that, and that will differ indeed between different countries or even regions, and that's why we're now trying to indeed work together with anthropologists and social scientists. And what I do find out is that sometimes we're lost in translation because of our own background, and we have these meetings and we all want to try to tackle the same problem, but from different backgrounds, and then we're sometimes lost there. And I can imagine you also work with different disciplines. So do you have any golden rules, like how we can meet in the middle? And because otherwise it would be really hard to keep up these collaborations, because we might have the feeling it takes much longer if we do it like this. But I think it's really very important if you really want to have sustainable change.
You can get a more sound solution and actually save a lot of money.
Indeed.
On investments. And looking at your screen backdrop, I think another important and interesting thing about water, of course, is how water transfers. So it's one thing to get safe toilet usage in certain areas, but if the disease is coming down the river, you need big system transformation. Otherwise, no matter what people do locally, they might be receiving it from somewhere else.
Indeed, and of course, as you know, many people have this link with the water. They're drawn to the water because of rituals and traditions, social ties. So indeed, you cannot simply say don't enter the water here, because there is this. Because what we found out that the knowledge, for example, in Uganda is really high. Many people know the disease. It's different in Congo. So, but even when knowing this, they say, but water is our life. We need it. We cannot. So they know it when they enter the water, but they take the risk because they don't see an outcome.
And do you have examples of this system transfer information?
Oh, I think what I was mentioning was basic catchment understandings. I've often been perplexed with the Sustainable Development Goals, and very, very worthy though they are, I don't see a lot about, well, stop the pollution. Why would you let, and it happens all the time, major polluting industry be established upstream that sends a lot of pollution downstream, where the people have no other option for drawing their drinking water, or purifying the water then becomes a lot more expensive. And yet, so much discussion is of local fixes rather than understanding that, rivers connect catchments, or watersheds you'd call them in some countries, and that you're making the problem a lot more difficult if you permit pollution and then try and clean it up again. So achieving safe water for all means that those water sources need to be relatively uncontaminated or affordably treatable, which is often not the case.
And do you have then good examples of cases where actors upstream get this catchment conscience and take care of what happens downstream?
One example that immediately comes to mind, although I don't know the end of the story, is a few years ago, my then PhD student, Dr. Chandra Sametko, who's now actually, I think, working in international development work, he was working within the Indonesian government, and they were looking at the Citarum Basin, where it's a lot of the catchment for Jakarta, the capital city's water supply. It doesn't actually run through Jakarta, but it's where the water supply is drawn from, and it was highly, highly polluted, with a lot of heavy industry, including, a lot of internationally owned heavy industry, some, pretty famous sportswear brands and the like. And very cleverly, the team working on it, they established a big collaboration of people interested in cleaning it up. But first they called it the dirtiest river in the world. Nobody questioned that. He said they never knew if it was or it wasn't. They just thought it was a good catch cry and it got everybody in. And they had stakeholders from all over, including international ones, some very, very famous international NGOs. And so it became a sort of complex issue of actually putting pressure on some of the European and USA firms to say, do you realise how much you are polluting this water because you are not investing in proper water treatment, or you invest it because you're required to in government, but then you switch it off on the days the inspector isn't coming, etc., etc. The things we do know can happen in many developing countries. And basically they built up a collaboration of major organisations to clean up the catchment for the common good. And as far as Chandra was checking it, tracking it, that went fairly well. Now, what, the ultimate situation was and the ultimate level of cleanup, I don't know. It's a thing that would have taken 20 years for sure. But it was a situation where collaboration and a bit of political suasion was very important. The classic collaboration arguments of get everybody to find a common goal and work together. I suspect there was some mental models. They wouldn't have treated it that way specifically, but mental models running behind this. For instance, if a major sportswear company thinks, yeah, fine, you can save a lot of costs in a developing country, you've got cheap labour, you can just, pump your dyes out in the river, doesn't matter, nobody's checking. That's an opportunity to reframe and say, actually, the cumulative level of pollution and dangerous pollution going into this river basin from maybe, 20 different factories by 20 major problems, major companies or major factories is an issue and does need cleaning up. It's a matter of corporate social responsibility to do so. So that's where there may well have been some latent mental models, even if it was as simple as it doesn't matter, that could well have been worked on, because certainly there was persuasion in that case that it was important and it did matter and it was everybody's responsibility to work together and clean that basin up.
Yeah. That's maybe coming to another question from my part. As you also mentioned in your presentation, it was on the different values, and you can identify these values and you maybe can find a common ground on, okay, these are the values that we agree on, or these are common as a basis for co-designing a solution. But that doesn't mean that it will be implemented as well, because in the end, often we come to a very narrow cost-benefit analysis to evaluate whether or not certain approaches will be implemented. We have a case here in Flanders where one of the entrepreneurs said, the project that I've done here is a philosophical project because not all the benefits that are generated with this sustainable water project can be implemented within this narrow cost-benefit analysis. And this is actually what we see in different cases, a very big difficulty, how that the values that are being created can first of all be identified, but then also being incorporated in decision-making in the cost-benefit analysis. And in your presentation, you spoke about moralistic, aesthetic, ethical values, but these are not easily counted. As somebody also mentioned, not everything that counts can be counted. And I think these values that you presented are actually values that are not easily can be counted and can be incorporated in our narrow thinking of cost-benefit analysis.
That's a complex question and comment, and I really like it. I think you're saying several things there. First of all, I'd say that those 10 values that I put in that one come from certain research and derived from Stephen Kellett's work, which began with wildlife and has been applied to water and lots of other situations. It clearly works on landscapes. It doesn't mean they're the only, and it illustrates the variety of values people can hold. It never comes down to a, just two-way dichotomy of possible values, or that there's only one. So what it alerts us to is that many values can exist and coexist, and we ought to be aware of and looking for them. But I wouldn't say that will always be that 10, because for different situations, different ones should be explored. They're environmental ones, but there's also, family values, etc., different sorts of relational values. So I would say there's always many and to look for them, but they're not necessarily specifically those ones for all settings. I love your reminder of the point that not everything that counts can be counted, because so much, the Western working world has been spending decades thinking, numeric metrics, trying to cajole important things into something measurable when the alternative is to explore it in qualitative ways, but appreciate how important those things are. And as you said, cost-benefit analysis, my gosh, what it costs is surely not the only value. Yes, in real projects you will hit limits of affordability, and that's highly important, particularly in developing countries where the cost of doing something at scale can be absolutely huge. But yes, I think I'm with you there that you would look to a range of values in terms of thinking, well, what are we trying to achieve here and what is important to people? You would hope in most societies, well, we know we can't live without water after a few days. We would hope that most societies value their health and that of their children, although they may have different mental models as to what contributes to health. So yeah, generically, I would definitely be looking to values and debating values. And for instance, I'm very keen on what's happening in terms of corporate social responsibility. And that actually reflects, to me, different types of values coming in. It's not always the, almighty dollar, euro, or whatever one's currency is, but it's a more rounded assessment of importance and achievability.
Mm-hmm. Yeah.
Yes, I'm just looking at my own notes and also what you said and what you have been doing, like these participatory approaches, because I do think that these could be really important for the control of waterborne diseases, because usually the NGOs or interventions, I mean, they respond to outbreaks, and then they have these short-lived results because then money is withdrawn, project is finished, and so on. And I guess one way out of this is this participatory approaches where you involve the community and important stakeholders. So you increase resilience of the communities themselves. Do you have good examples of this where maybe you were or to inspire my research, for example?
Yes, I hope so. A few years ago now, it's about 2006 to 2010, we did a project actually funded by Australia's aid agency. We did it in Solomon Islands and Vanuatu. I'll tell you about both. But in the Solomon Islands, the local people, the water department, the National Water Department, consisted of 3 people. So you can imagine, the capacity level there. Named a problem that they wanted to solve and understand, and our team took a participatory approach with them and with other stakeholders. So they named a catchment that supplied the capital's water supply, and we worked there with the local people. We worked with all the government departments, bringing them together, which actually was a bit of a new thing for them too, because they weren't used to collaborating. Lovely having the water department and the health department in the same room with a few others. And we invited NGOs as well, which was actually really interesting because they had generic knowledge and they didn't have specific knowledge. So that was kind of a bit of a challenge for all sides as well. But we weren't explicitly eliciting mental models. And yet, in fact, we sort of were. They were all drawing influence diagrams as to what influenced what. First of all, they set a goal. What's your goal for water? And they had different variants, but it came down to, water quality and water quantity. And then usually some beautifully framed something or other, water for all. It would be some lovely local expression that, we knew what it meant, but never would have thought of putting it so expressively ourselves. And then they sort of traced back, well, what contributes to having enough water? Well, this and that affects that and that affects that, and on you go. And what affects the water quality and all these things. when we did it in separate workshops first, actually all culturally appropriate as well. So the villages ones were actually in places of their choosing, up in the catchments, in their villages, in the open air. The government and NGO people were happy to come to a hotel. Then we brought them all together, which with considerable trepidation, because some of them had been in argument for 20 years. This was not a comfortable thing to do, but we managed it well, and it went really well with good local advice. Thank you, Morgan Waru. And then we, together in the joint workshop, we overlaid them together. And then people saw, oh my goodness. So the water engineers are thinking, we have been completely fixated on this part of the diagram, which is about technical factors. And we've been totally ignoring what goes on further up in the catchment, whereas the local people would be certainly conscious of what's going on with pig farming and things like that. And on it went. The NGOs were bringing in things like affordability in the urban supply, for instance. We also heard some great stories in the course of that study. For instance, one well-meaning country had spent a lot of money. So the Urban Water Supply Department, they'd had this 20 years argument with the people up in the catchment over the water. And in fact, the people up in the catchment had been blocking the water supply underground because it came from a cast limestone system. Nobody could even prove or be sure they'd done it, but they were pretty sure that that was what was happening. And the people later said, yep, that's what they were doing. But there was this very, very difficult relationship, and I'm always forgetting where I'm going with that story. So that doesn't.
Does it have a happy end? Because it sounds really quite intense.
Yes. So there had been these terrible relationships for 20 years, and yet in the end they became really comfortable and communicative with each other. Oh, sorry. So the story was the foreign government had heard about this warfare. It was almost, well, we'll solve the problem. We'll give you bores so you can get the water from within the city boundary, and you don't even have to deal with these villages up in the hills at all. Now, what they all overlooked, of course, was that you need a lot of diesel and electricity to pump the water up from underground. So yes, the government looked to have total control over it, but they actually couldn't afford to run the pumps because the economy could not afford that sort of money. So that was at the point they actually came to us and said, okay, well, actually, we've got to go back to natural solutions. And by the end of it, they were, particularly after that big workshop, there were terrific relationships. It was just wonderful seeing water staff going up to the catchments, talking to the villagers, you know, really having developed good relationships and talking about ways of solving it. And the villagers were saying, actually, that's our cousins down in the city who we are denying water. A lot of us have migrated to the city and we are denying our own people safe water. So we all need to consider the bigger picture and we all need to work together over it.
Yeah.
And creating a shared understanding.
Yeah.
Yeah, absolutely. And a reframing around a bigger picture.
Yeah.
We've published that as Haverman et al. In Ecology and Society. Suzanne Haverman led that part of it.
Yeah, I think this is very inspiring and also very important to indeed increase the longevity of all these, all the money being pumped in for only short-lived results. So I think indeed this shared understanding, the shared values that you need to realize that indeed.
And investing the time and money to do that, because strong foundations give better results. So yes, it may cost more to put a social scientist on the team, but I'm convinced it will save a lot of problems. Having local people on the team can make everything go so much better. So yes, investment at the planning stage pays off down the track.
Yeah.
And on what other disciplines are you thinking if you would have the ideal setup of a group of, as you said, a social scientist, a lot of local people? What kind of other, if it would be your...
Well, I would say, please, nobody treat social scientists as one size fits all. in a biophysical science project, you wouldn't think the physicists can do everything. They can't. Well, only by going back to their high school science education, for instance. It can be the same with social scientists. I mean, I like to think many of us are fairly interdisciplinary and have different, you know, a broad range of skills, but they can still be somewhat different skills. But yeah, I would always include social scientists in a team. I would always try to include somebody with, certainly anthropological geographers can do it too, a sort of cultural understanding, people who look for that sort of thing. I would never personally, I'm going to get into trouble for saying this, just have a behaviour change specialist of the narrow type view, but I think agricultural extension people are pretty good. So it needs to be a mixed team for the skills available. Definitely local people, and there are all sorts of ways of going those. I would look to what you can learn from participatory methods, such as whether you do participatory rural appraisal or participatory action research. They've got different merits. Use them too. So yeah, team, but the team also has to communicate and have mutual respect for what each other offer, and a common language. Gosh, I was on a project years ago where we must have spent half the project working out the foundations. This was decades ago, but sort of loosening up, and each discipline realizing they did not have the sole and correct framing of the problem. Mm-hmm. That took a long time to build and get beyond. But when it did, then things really sped up. And that group, with some changes in membership, including me going to another university, has continued for, must be 25 years now. They've kept their skills. They've kept that interdisciplinary respect and understanding. So it's rolled through and through and through to other projects. And I'm sure would have influenced other places through the types of staff movements and mutual learning through conferences, etc. So it's a highly worthwhile investment. But to collaborate, interdisciplinary collaboration with communities, everybody needs to be fairly humble with an open mind to realise they have one truth but not the only truth, and that hopefully everybody else on the team has something complementary or even different and highly challenging to offer towards ultimately all wanting a better solution.
And what golden rules can you give us to come to this common language? Looking back to your case of that it took a lot of meetings and to find this common language, would you have now, looking back, set another approach that maybe would have started by doing this first, so that...
Yes. I think Tina's going to say the same, are you? Or did you want to share an experience?
Yeah,
Tina?
so that we don't have to take years and years to find this common language, that we can learn from your experience.
I think interdisciplinary training is a lot more common now, mm-hmm. and interdisciplinary teams and cross-cultural teams are a lot more common now. I think I pretty much said it. Investing the time in talking, meeting with respect. Nowadays, I might, bring in some tools like mind mapping and mental models. But actually, I found going on field trips was really, really valuable. I remember one in Thailand with a hydrologist. I rediscovered the photos the other day in a cleanup, and just that talking together as we talked to the local people on a hillside overlooking their river basin was just so mutually enlightening. It was fantastic.
Mm-hmm. And identifying the different values, does this help to find a common language? Is this
absolutely?
Do you see this as a part of finding this common language?
Absolutely, absolutely. Because I think it also brings out the relationship with goals. And, if you're in a particular project, whether it's a development one, maybe with an NGO, it's really important to be alert to what the different parties are trying to achieve and not to presume it's always the same. But if you can somehow, inverted commas, map that you could find a good reframing that wants to achieve this and that.
Yeah. And in your presentation, you really you focused on this natural of the values linked to nature. Do you have a broader? Did you also did some project where you did a broader scope, like as you mentioned earlier, relational values, things of social cohesion, these aspects, mapping these types of values, because also water has an important role.
The part of the study I described, which was in Queensland, Australia, where I live, and it actually had the cross-cultural element because we had it's Indigenous but Aboriginal in our region, and we had an Aboriginal team member doing that part of the study, very much, you know, closely in the team, but she was always the front person for talking with the Aboriginal traditional custodians. You know, we started with a framework and went flexibly, and whilst we were focusing on the people-environment relationships, the people and waterway relationships, the social ones came out too very, very strongly, and some others besides. They really became nuances that had been overlooked by previous users of that Kellett framework. But then I fell in with a team of writers who actually from the IPBES process, who had got interested in relational values, which is about both relationships with environment and relationships with other people. But it stops treating the person as kind of singular and on their own, or collective if you're talking about groups of people, and looks at them in terms of, you know, how are they seeing the world? What are they appreciating in terms of how they should relate to environments? You know, which type of relationship is valued in themselves and by their society, and how you should relate to other people. And in fact, the one of the many fascinating things about working with Australian Aboriginal people, and I'd say probably Torres Strait Islanders as well, is how they go together. You know, people-people relationships and people-environment relationships are a much more sort of triangular thing under a common set of values and rules.
Yeah.
But yeah, so the idea of relational values, you know, if you're looking up literature, look up relational values. There's a special issue in Current Opinion and Sustainability on them. Quite interesting.
But also maybe how water can reinforce relational values.
That's an interesting one. I wonder if
because water is, as you mentioned earlier,
I would encourage people to think about them, because often we're not conscious of our own values. We just assume that something's right and don't necessarily open up to the other people thinking quite differently and valuing quite differently. So comparing values about, you know, what's the appropriate way to relate to environments, what's the appropriate way to relate to other people, how do they go together? Nice example that comes to mind is colleagues were telling me, whoa, back in the 1980s, when New Zealand was revisiting the Treaty of Waitangi, which was the original settlement between Maori people and whatever they like to call their non-Indigenous arrivals, there was a treaty negotiated called the Treaty of Waitangi, but it had lapsed for, an extremely long time, can't remember, 100 years or more. And New Zealand had a number of inquiries, I forget quite how it was done, but they had a big investigation and big national dialogues about living by that treaty, reinvigorating it, making it real. And my colleagues working on it was one of the big shocks to non-Indigenous New Zealanders was some of the Maori rules for appropriate treatment of water, and that you did not put land-based refuse into the water. Like, water belongs to the water, the land belongs to the land. Do not dispose of pollutants in the water, which actually is a pretty good ecological rule, come to it. But that was quite a shock apparently at the time, but because of the necessity of agreement, that had to be discussed through. But apparently at the time it was, you know, quite confronting. And I remember, you know, those were the days when, you know, society didn't hesitate too much about, you know, dump your pollution in the river. Not sure if that's getting off track, but I think it's just an example where New Zealand was forced to hear and enter into the Maori relational value with the environment, with rivers.
Mm-hmm.
Well, I think we will have to close it down here. I will remember from this debate, take a social scientist, 1 or 2 on board, create a big network of stakeholders, talk, interact with each other, keep or have an open mind and treat each other with respect. So this was very valuable to me. I hope you enjoyed it as well.
Very much.
I'd like to thank you both for this inspiring talk.
Thank you.
Thank you very much. I really did enjoy it. Thank you.